The Scottish Funding Council about 18 months ago took a review of how they were using the money in knowledge exchange and research and decided to test the concept of innovation centres. And the idea there is, and really the mission is, to create an internationally open and ambitious community in Scotland that is working on initiatives that will benefit the society but ultimately have a big economic impact in Scotland. The £10 million that we have been given will be used to create really exciting innovations, but particularly focusing on digital intervention and how we might be able to allow people to stay at home for longer and reduce the impact of unnecessary usage of the health and social care systems in Scotland. So the Digital Innovation Centre will work with key bodies throughout Scotland, and to put that into context, the open community that we are looking to create will consist of 19 universities, 32 local authorities, 14 territorial health boards. I think there's 6 special health boards and numerous third sector organisations, along with SMEs and corporate organisations that are working in and around Scotland. If we can create really interesting topics for these companies to work with and work on together, really getting to the bottom of the issue by really understanding from the outset what the challenges are. Some of the things that we will look to do is, in our exploratory environment, take very difficult questions to which there are no answers right now. And an example of that is that when we take a topic, we will bring patients, users, family members, academics, health and care professionals all together to look at the particular topic from every angle. And by getting that depth of understanding and creating that knowledge that we can then share throughout our community, we can then hopefully stimulate these companies to have much bigger commercial impact and create economic benefit for them, which ultimately we hope will result in wealth generation, job creation. DHI aims to work with SMEs who have products that are close to market or are ready to take to market by really helping them to understand exactly how to get into supply chain mechanisms and potentially where they might be able to get funding to help them. We're working really closely with Highlands and Islands Enterprise and Scottish Enterprise to look at how we can do that. In addition to that, one of the key things that we will look to do is engage with the investors in Scotland, ranging from angels through to investment banks. And by creating that community, we can then promote and stimulate that activity in the area of our factory. And the idea by doing that is that the promotion of innovation in Scotland is really key, and the economic impact of the investment coming into Scotland, given the position that we have, has been very well known for that capability, means that we can try and give those SMEs a bit of a step up. The DHI aims to create this open and accessible community in Scotland. And firstly, what we need to do is spend a bit of time understanding actually who are the players in Scotland and how we might engage with them. So we're undertaking an exercise to really get to the bottom of that, where we will look to see where the skill and capability and experience is in Scotland, and we'll look to layer that to understand it from an academic point of view, so working with all 19 universities to understand the people who want to get engaged and work on projects. We'll also look to do that with the local authorities and the health boards to look at the clinicians and professionals that have a key interest in innovation. And then finally, we'll be working with the businesses, several hundred of them within Scotland in the digital health marketplace, that we would like to try and understand their skills and capabilities. And that will inform where we might create some of our clusters and our marketing activity, and where we will engage in a really meaningful way. Following on from that, the plan is that we can then start to break down barriers by knowing where the key people are throughout Scotland and creating really interesting collaborations. We can look to enable access and help professionals that are struggling with challenges day to day who could be doing with technology to really aid the process and the patient or user experience, but also to give those small companies much deeper understanding of what those professionals actually need, which the end result should be a much more saleable and attractive product or service for the health or local authorities, procurement teams to want to be interested in. And then finally, what we really want to do is create a community of investors that will range from investor banks to angels, working with the economic agencies, in particular Highlands and Islands Enterprise and Scottish Enterprise, to create funds that will enable those companies to get the support that they need through this process. It's quite a long process at times, and those companies, we want to be able to support them as much as we can. And if we can get procurement teams working really closely with those investors and the collaborations, then ideally we'll have products that will be easier to get into the market in Scotland. And once we can prove the concept here, we're then in a very strong position for internationalisation. The digital health community in Scotland is an exceptionally exciting one. If you consider the skills and capability that we have in health and social care in Scotland, that are widely considered to be some of the best in Europe, if not beyond. We have 19 excellent universities in Scotland with key skills in informatics, medicine and design. And in addition to that, we have an excellent reputation for innovation and life sciences. Following on from what I just said, DHI really looks to harness all of that skill and capability that exists and work within Team Scotland to really support and deliver the vision of world leadership that Scotland has in the context of the digital health marketplace.